In functional medicine, a symptom is rarely an isolated event. A single trigger often ripples across interconnected biological systems, requiring a treatment approach that targets root causes rather than surface-level reactions. But tracing those connections requires evidence. Practitioners must cross-reference thousands of fragmented, rapidly updating peer-reviewed journals just to validate a single treatment protocol. Mapping that dense literature against the highly specific nuances of an individual patient's taste demands hours of manual search time that most clinicians simply do not have. The bottleneck in advancing patient care lies entirely in the physical speed of data discovery and verification. Traditional search engines offer broad, consumer-level summaries, which fail to meet the strict precision required for clinical application. Relying on generic AI chatbots is even riskier. Because they lack medical guardrails, these systems often hallucinate, generating plausible-sounding but entirely inaccurate physiological connections. Without a rigorously bounded, clinically focused analytical framework, integrating these tools introduces unacceptable liability into a medical practice. To solve this, Ask by Holistic Health was built. It is a clinical AI co-pilot designed exclusively around the functional medicine paradigm. At its core is a foundational database containing over 100,000 peer-reviewed medical studies. Instead of processing this massive data randomly, Ask routes every piece of information strictly through the analytical lens of the Institute for Functional Medicine, or IFM, framework. Applying this specific architectural constraint ensures the resulting output is directly actionable for root cause practitioners. We can test this by formulating a highly specific, multivariable clinical question. This interface shows the Ask search bar, where we enter a query asking if nattokinase, an enzyme derived from fermented soybeans, has been studied for the reversal of arterial plaque. The system instantly cross-references the query against the IFM filtered database, scanning for relevant trials, dosage variables, and physiological outcomes. A deep dive literature review that traditionally required hours of manual reading is executed in seconds. The generated text outlines mixed but promising results for nattokinase and plaque reduction. It highlights a trial where the enzyme demonstrated greater effectiveness in reducing carotid artery thickness than simvastatin. Trust is established through inline numerical citations linking directly to the source literature. Clicking those citations reveals the references list, showing an unbroken chain of evidence with direct outward links to the primary medical literature on PubMed and ScienceDirect. True clinical utility requires an instantly verifiable, transparent chain of peer-reviewed evidence. Beyond the research interface, this architecture extends to the broader operational workflow of a functioning practice. Through a feature called client matching, practitioners connect with high-intent patients who arrive with their complex health histories already compiled. Patients complete a guided consultation to create an AI blueprint, a pre-generated intake document that maps their symptoms, lifestyle, and goals before the practitioner even begins the first session. Combining these pre-analyzed patient blueprints with instant verified research shifts the practitioner's cognitive load away from data gathering and onto active patient care. Historically, enterprise-grade clinical software has been locked behind restrictive subscription models and high costs. The Ask Copilot removes this barrier entirely. It is completely free to use, requiring no trials, credit cards, or hidden commitments. Practitioners can begin building their proprietary clinical knowledge base immediately by visiting holistic.health/ask. By eliminating the friction of deep research and the barrier of cost, Holistic Health makes advanced functional medicine accessible to any practitioner.